I wanted to kind of go over the Part D prescription drug phases. Whether you have a Part D prescription drug plan or a Medicare Advantage plan that covers your drugs, it doesn't matter. Part D phases, they recently changed it. So, go back to my screen share here. So, the Part D, all right, so you have Part D. Boom, 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 boom. All right, so we have Part D prescription drugs. You either have a Part D plan or MAPD. So MAPD is Medicare Advantage prescription drug. You guessed it. And then Part D is just your simple Medicare plus drug, right? So it's separate. Medicare plus separate drug plan. All right. The reason that I wanted to type this out is because I want to show you something very, very neat. The phases. So it used to be that the first phase was your deductible phase, and that still is the case. You have a deductible phase. First phase is your deductible. Say your deductible is like $590. You're going to pay the first $590. It excludes something that's really cool, and people have, you have to remember this. The drug plan phases exclude tier 1 and 2 a lot of times, and sometimes tier 3. So that means that you're only paying the deductible on tier 4 and 5, most of the time 3, right? So tier 1 and 2 and 3 sometimes are excluded, right? Tier 2, or the second phase, ICP, initial coverage phase. The initial coverage phase is where you have copays. And those copays, pretty much similar to the maximum out of pocket we went over on Medicare Advantage. Copays that you pay for that drug are going to add up to the maximum out of pocket. Your max out of pocket is your final stage, which is $2,000. That passed into law around 2025. So the Medicare, it was in the let's see, the Biden administration passed into law was it I can't remember which bill it was, but it gave a max out of pocket of $2,000 for drug coverage, which is very beneficial to a lot of people. The one problem that you see with it is it benefits people that, of course, we're paying a lot of money for drugs, but then it does not benefit the other people. I think it's a good thing. Something that they used to have, and you hear about this, but you don't have to worry about it anymore, is the donut hole. And the donut hole's actual name is coverage gap. And it's where they would pay the patient, or the beneficiary would pay 25% of the drug costs. And what that would leave us with is you'd have a lot of people, like if you're taking Trelegy, for example, or an insulin, an expensive insulin, you're gonna have that deductible phase. You pay $590. Then you're gonna have the initial coverage phase. Well, you're gonna be in the initial coverage phase up to a certain amount so let's say you pay $2,000 in the initial coverage phase. Well, then you would hit the donut hole and you'd pay 25% until you got to like $4,000. It's crazy. Nowadays, you're in the initial coverage phase, you're paying copays, you hit the $2,000 max out of pocket, you don't pay anymore. You work with me, I will make sure that every single avenue is exhausted so that we can get you the lowest drug costs possible.